the MIC, it's measured of vocational needs. It may be used in vocational counseling, career planning, and job placement. In vocational counseling, the counselor can use the MIC to help individuals to understand their unique sets of psychological needs and how these needs will relate to their expectations of particular work settings. In career planning, the MIC profile of needs can be compared with profiles of the reinforcer systems, so for specific benchmark occupations. In job placement, knowledge of needs of employees is important for employers with the standpoint of maintaining a satisfied workforce as a necessary condition for maximizing productivity and minimizing turnover, absences, tardiness, accidents, and injuries. The MIC measures 20 psychological needs and 6 underlying values that can be found to be relevant to work adjustment, specifically to satisfaction with work. So it goes through several things such as ability, achievement, activity, authority, company policies, and practices, compensation, your creativity, independence, moral values, recognition, responsibility, supervision, and working conditions, obviously. So, and the 6 values that it talks about: achievement, comfort, status, altruism, safety, and autonomy, excuse me. So the MIC report basically is a computer-generated printout, and it provides a profile of need and value scores on the first page, and a listing of occupations for which satisfaction is predicted or not predicted on the second page. So the MIC is designed to provide the counselor with information about an individual's vocationally relevant needs and values. So it's important before you meet with your client that you need to go through the MIC report and fully make sure that it is valid. The reason why I say that is because when you interpret the MIC, the counselor needs to make sure that the LCT score, which is in the upper left-hand corner of the report, and that determines the consistency the individual responded to the questionnaire. So if the score is above 33% or 50% for the ranked form, the pattern of response may be assumed to have enough consistency for interpretation. Now, if the LCT score is below 33 or 50% ranked form, the counselor needs to make sure that you proceed with caution. Because in that situation, they have random responses. So that's the reason why it's important to make sure that the counselor examines the consistency of the MIC before going over it with their client. If the analysis of response consistency indicates a random response pattern, you need to think about some of the possible causes: lack of understanding, poor motivation, carelessness, faking, or the possibility that the profile accurately reflects the individual's lack of clear preferences for reinforcers. So basically, the scores, if the LCT score is above 33%, or the assumption of non-random responding, the counselor may wish to interpret the profile of need and value scores of the following ways. Scale scores may be placed in a rank order to show a hierarchy of needs. The profile of needs may be inspected for the most important and least important needs. Scale scores may be interpreted as indicating needs that are important. Mixed scales may also be interpreted by referring to the norms. The MIC may be interpreted in terms of the likelihood of satisfaction in a specific occupation. It can be interpreted in terms of groups of occupations. It may be enriched by using the Minnesota Occupational Classification System, and it also has more specific components of the underlying value system. So once again, this is one of these type of questionnaires that, yes, you can do this with your patient. I think that especially if you get the higher scores and it shows a consistency, that is a good thing, and you are able to see what the patient would be good at, what their type of values are, what type of careers that would be good for them. However, if the score would be lower, I would definitely look into doing different testing, possibly with the patient. I think that's why it's important that we understand the type of testing that we're giving our patients, and to make sure that we fully go over the results before we actually go over them with the patient, just because you don't want to give them some type of misinterpretation or have them thinking something is wrong with them. Which in that instance, there may not be anything wrong with them. It's just like the report said, they seriously might lack motivation, and that just might be who they are. And this would be an area that you can work on with them during their counseling. So, yeah, that is it.